Welcome back to the channel. Anthony Fauci's out there trying to sell his book. And in the interviews he's doing on the media circuit, he's talking a lot about his COVID-19 policy. And of course, according to him, he was perfect. He did nothing wrong. Maybe the school closure was a tad long, but that's not because his fault. He said, I wanted to open safely. That's what he's telling people. Well, I think it's a dishonest media campaign going on right now. Anthony Fauci, of course, I believe is being a little bit dishonest, but that's his prerogative. Of course, nobody wants to admit to all the things they did wrong. But the real failure, of course, is the media, the journalists, in quotes, the journalists. Because if you're on Good Morning America, are you really a journalist? I don't think so. The journalists who could ask him tough questions, who could actually say, listen, here's something you said, here's something you did, here was the best evidence at the time. Will you at least concede that you were wrong, not just in retrospect, but at the time? They don't say those things, probably because they don't know those things. Maybe they're incapable of learning new things, but also because they like to fawn over Anthony Fauci because he's on the same political team. Yes, Team Democrat. If you're on Team Democrat, then you can go there. You can say whatever nonsense you want, and no one's going to hold you accountable. So I have a new article out in Sensible Medicine. Oh, no, not Sensible Medicine. This is in Vinay Prasad's Observations and Thoughts. Of course, I write for both Sensible Medicine with my colleagues, Adam Sifu and John Mandrola, but this happened to be on my personal Substack, Vinay Prasad's Observations and Thoughts. You should check it out. It's called Anthony Fauci Objectively Did a Bad Job. The media coverage of his book has fallen short of engaging with his actions and words. Is it too much to ask journalists to be journalists? All right. I'm just going to give you the 12 reasons why he completely failed. Like he did a bad job. Like this is objectively a bad job. And I also want to say there's going to be zero ad hominem here. I'm not going to say anything about him as a person or use any of those, I think, pejorative labels. We don't have to do that. We can just point to 12 things he did wrong. The next thing I'm going to say is this is not through the retrospectoscope. These are not things that I know are wrong now, and at the time, it was reasonable what he did. These were things that were wrong when he did it. When he did it wrong. And so he should be held accountable for getting it wrong at the time with the best information at the time, because that's what these 12 things are. All right, let's do it. Number 1, masking. Oh, yes, masking. Well, I don't want to talk about this because we talk about this so much, but of course, he initially said you don't need to wear a mask. There's no evidence that they work. There may be compensatory behavior like you touch your face. This was the 60 Minutes interview in early March. Then just 6 or 8 weeks later, he went back out there and said you should cut your sock off or cut your shirt and make a community cloth mask. He says he lied the first time to protect the healthcare worker supply. That can't possibly be true because even if you told people 6 weeks sooner to cut their sock or their shirt, cutting your sock or your shirt does not actually take away masks from healthcare workers. So I think when he says he lied initially, that's the lie. He was telling the truth initially. That's what the best randomized evidence from Cochrane suggested. That's what the best data suggested. He reversed his position based on advocacy in the absence of evidence. Later, he was to say there's new evidence that emerged. There was no such evidence. So the second time when he told you to do it, that was a lie. The other things he did was he allowed the CDC to push that down to kids as young as 2, which is boneheaded. He never once went on TV and said, I disagree with masking kids between 2 and 5. He went along with the party line, even though not only does that have no evidence, it makes no sense at all. And then here's the worst thing. The biggest failure is that he's the head of the National Institutes of Allergy and Infectious Disease. He controls a $5 billion research budget to study infectious disease. If he had snapped his fingers and told his minions from his Gmail account that they should start a randomized trial of masking, that would have happened. He didn't do it. He repeatedly performed 0 cluster or individual randomized controlled trials of non-pharmacologic interventions at the broad population level, at the community level, while he was on TV making many, many proclamations. And that is an abject failure. A scientist who doesn't really know the answer should do studies to reduce the uncertainty. He had the budget. He had the ability. He could have done those studies. He could have launched them. He could have commissioned them. He could have put out an RFA for proposals. He did not. He never generated evidence. That's his biggest failure, to control the research budget and go on TV spouting bullshit and never run a study. Biggest failure. Number 2, he repeatedly said that people who already had COVID-19 would benefit from vaccination. That was an error at the time, not just in retrospect. There was clear evidence that people who had already had COVID-19 had floored rock bottom rates of subsequent COVID-19 leading to hospitalization or death. And the only thing that the vaccine had shown benefit for was the acquisition of symptomatic SARS-CoV-2 and hospitalization at that time. And there was no evidence that that population would derive additional benefit on those clinical endpoints rather than beyond what they'd already achieved from having had COVID-19. There was evidence that your antibodies would go up, but you have to be a delinquent scientist to think that antibodies going up after re-exposure to an antigen means you have better clinical outcomes. Of course, antibodies go up after re-exposure to any antigen because the body doesn't make antibodies against every antigen all the time, because your blood would be as thick as molasses if you made all those antibodies. Instead, you remember through B memory cells, those antibodies and make those antibodies when you need them. So of course, a booster will stimulate the antibodies, but does it actually lower the risk of severe disease or death? And the answer is, in people who've had COVID-19, there was never any evidence of that. Worse, he could have, again, commissioned a study to study vaccines in that population. He didn't do that either. So he's going on TV, making a recommendation, pulling it from his ass, not generating evidence. And now in retrospect, I think it's pretty clear that he was incorrect about that. The rate is so flawed that there couldn't have been benefit. And I think that was known not just then, but at the time. And I wrote many articles on that. You could go check my history on this channel. Number 3, he supported vaccine mandates after he knew that vaccinated people could still get COVID-19 and transmit. And he also must have known that a general principle of medical ethics is you cannot compel a medical intervention on a third party if there is you cannot compel a medical intervention on an individual if there's no potential way that could benefit a third party. And I know people like to say that, well, vaccination would dampen the transmission rate modestly for a short period of time. It might have done that in early 2021, but that certainly isn't the same as a benefit to third parties, because that dampening that rate for a short period of time not going to do anything over the course of 6 months or 12 months or 24 months. It's the same thing as pouring a glass of water on your yard when a forest fire is burning, coming up to your house, thinking, oh, that's going to delay the time until my house vaporized. Well, that's a pretty stupid thing to say, and that is not enough to force somebody to pour the glass of water on their yard, as the analogy would dictate. Number 4, he goes on TV now and he says, we made the right choice to close schools in 2020. He never tells you that Sweden actively did not close elementary schools in 2020, and he never tells you that he could have learned from the Swedish experience even 6 weeks later. By 6 weeks, Sweden had shown that keeping elementary schools open did not lead to a massive casualty toll, and it was safe to do so, and the kids were doing just fine. And all of Europe, most of Western Europe, reopened within 8 to 12 weeks. Meanwhile, Fauci was on television. You can go pull the clips where he says that Ron DeSantis' decision to reopen in the spring of 2020 was dangerous, kids could get infected. That's what the headline reads. He is fear-mongering about DeSantis, who had the correct policy. He was incorrect at the time. DeSantis was correct at the time. DeSantis had more balanced advisors, the same people who Fauci wouldn't talk to or engage with, the Great Barrington Declaration authors, for instance. We're coming to that point. Number 5, Fauci says, I have nothing to do with 6 feet social distancing, but he himself continued to repeat that. Moreover, he could have actually done a cluster randomized trial of 3 versus 6 feet and sorted that out for people. He never commissioned such a study. Once again, he's the NIH director. He's got all this money. He's got all these researchers, but he's not running any studies. He's just talking. And that was a mistake, not in retrospect. At the time, you're in charge of you have a huge budget during a pandemic. Run randomized studies that will help inform people during the pandemic. It's not rocket science. It's really public health and medicine 101. Number 6. He refused to engage with his critics, the Great Barrington Declaration authors. He refused to engage with Francis Collins. The emails have been leaked where he calls them a fringe group and that they should be demonized in the media. That's basically what they did. They called him fringe and they use all this term. He's on TV now calling Alina Chan, a woman from MIT who believes the virus may have begun in a lab. He calls her fuzzy, a fuzzy person. He uses this very soft ad hominem rhetoric to delegitimize his opponents in the public eye. It's a very despicable trait for a scientist. Sorry, politician, that's what he really is. It's a despicable trait for a scientist, and I think he's doing it to great effect. Number 7, he now admits that lab leak is a real possibility, but he actively worked with people to prevent that possibility from being discussed, and I think that's a clear error he made. Number 8, he repeatedly lied to Congress about NIAID funding gain-of-function research, which they did. And, I think that's clearly perjury in my mind. Number 9, he failed to understand the results of EPIC-SR. This is a quote from a New York Times article. Fauci says he believes Paxlovid kept him out of the hospital even though he tested positive again. At the time he said that, we had a randomized control trial in people who had been vaccinated that Paxlovid actually did not work. It failed the primary endpoint of that study. So he's saying that he believes Paxlovid did that. Well, there are people who slaughter a goat or drink a glass of all these mixed up vitamins and minerals, and they all credit this is glass of hocus pocus is why I'm still alive today. And that's no different than what he's doing. It's a not scientific way to credit your health to a drug when the randomized evidence shows that has no such thing. Number 10, he did not support randomized control trials of the kids' vaccine powered for clinical endpoints. Instead, as I detail in the article, he said he hoped that the FDA approved a vaccine at that very young age, which had a very ultra-low risk of bad outcomes based on a very flawed, non-inferior antibody target titer. That's very bad, and anyone at the time would have known that that's a stupid thing to do. I knew it, and I said it many times. Number 11, this is Fauci, quote, this is a headline, there's no need to delay the second dose of COVID-19 vaccine so more people can get the first. Fauci says, well, delaying dose 2 would have saved many lives. That's what the United Kingdom did. He was wrong about that at the time. And there are other people who are doing different strategies. And he never came back and admitted he was wrong at any point. Number 12, Fauci responds to concerns about blood clots in Johnson & Johnson. He says, quote, it's less than 1 in a million. Again, he's downplaying the concern. Now we know J&J, AstraZeneca, both pulled from the market. Now you're going to say that, well, that's known in retrospect. Actually, you can go read my articles and you can read my tweets at the time. I said the moment I saw that safety signal of VIT, vaccine-induced thrombocytopenia and thrombosis, which is a catastrophic blood cascade of platelet activation, I said it's game over for these products. They should not be given, certainly not to young women. And he didn't say that. He didn't say that right away. He was, I guess, comfortable with a population having a death side effect when there were alternatives that didn't have a death side effect. So I think that's not just bad in retrospect, bad at the time. So those are my 12 things. 12 things Fauci did wrong. He's on his book tour. If you're a journalist who's interviewing him about his book, you might want to learn about one of these things. It's called reading. So you'd have to read and talk to people who know things. And then you might write some notes. And then when you ask him questions, his questions can't be, oh, do you say you did a great job or a superb job? Oh, really? Thank you. You have to be a bit of a journalist, okay? And you're capable of it. When you disagree with the political person, you're capable of really pushing back hard. With somebody you agree with, you're not capable of it. And that to me is the most despicable thing about the media coverage. Am I going to read his book? No, of course not. And actually, that's not personal. That's not even related to COVID-19. No, I'm not going to read any COVID-19 book. Okay, I lived it. I followed it very closely in real time. Maybe I read most of Scott Atlas's book. That's about it. I thought Scott Atlas's book actually had some things that were interesting. I'm not going to read any of these people's COVID-19 books because when I read a book, I don't want to read about COVID-19. I want to read about what it's like to grow up in Naples, Italy in the 1950s. I want to read about what it's like to, what I'm talking about is fiction. Okay, I want to read The Goldfinch. I want to read something really transcendent and good, well-written, something like that. Even Project Hail Mary. Let's say I want to read a book that takes me away from things, that gets me, I want to read fiction. I don't want to read nonfiction written poorly by people who also have a poor grasp of history and science. So I don't read any COVID-19 books, okay? I'm not going to read any of them. Maybe 10 years from now or 20 years, I'll write my own COVID-19 book, but that's only when I believe that people want to read it. Right now, if I walked in a bookstore and I saw a COVID-19 book, I'm just going to walk away. All right. And actually, if I'm curious about you, do you actually want to read a COVID-19 book or you want to read something else right now? All right, leave it in the comments. If you like this video, you know what to do. Like, subscribe, comment, leave a message below. Hit the notification bell, send it to a friend. Until next time.